Gaucher's disease video presentation. Honors 1 Biology by Gregory Romeliotis. Gaucher's disease has a multitude of other names that are used by the scientific community. Some of these names are Gaucher splenomegaly, Gaucher syndrome, GD, cerebroside lipidosis syndrome, and glucocerebrostase deficiency. The most commonly used names are Gaucher's disease and Gaucher syndrome, and GD. The disease is caused by a mutation in the GBA gene, which is located on chromosome 1. Mutations can stop the gene from making the vital enzyme beta-glucocerebrodase. This enzyme plays a key role in breaking down the glucocerebroside molecule into glucose and ceramide. Without the enzyme, glucocerebroside and related molecules will build up in the liver, spleen, and bone marrow. This buildup is what causes the symptoms of Gaucher's disease and the main danger from the mutations. There are many different symptoms for this disorder that span across 3 different types. While symptoms may vary greatly, some of the most common symptoms of type 1 are enlargement of the liver and spleen, a low number of red blood cells, easy bruising, chronic fatigue, lung disease, bone disease, and arthritis. For type 2, they include poor development, seizures, spasticity, poor ability to suck and swallow, and enlarged liver and spleen. Finally, for type 3, seizures, skeletal irregularities, eye movement disorders, cognitive problems, poor coordination, enlarged liver and spleen, respiratory problems, and blood disorders. The Ashkenazi Jewish population is at most risk of contracting Gaucher's disease, with about 1 in every 450 people having the disorder. For the rest of the world, it's a lot more rare and only occurs about once in every 50,000 people. Type 1 is the most common form of the disorder, while the other 2 are much rarer. This disorder is inherited in an autosomal recessive pattern. As such, both males and females can be carriers of the disease. For a child to contract Gaucher's, both parents would have to be at the very least carriers. A child affected with Gaucher's disease will need to take an infusion every 2 weeks for the rest of their life. This can be performed at either home or at a medical clinic, whichever is better for the child. This medication will remain the same as they get older, as the disease does not change over time. For most children, they should still be able to play sports, go to camps, and generally do things normal children can do. Anyone with Gaucher's will be able to have a good, healthy child, so long as the other parent is not affected or is a carrier. Due to the disease being recessive, both parents will be required to have at least 1 gene for the disorder for the child to be at risk of contracting it. There are a few different treatments for Gaucher's disease, the 2 most notable ones being enzyme replacement therapy and substrate reduction therapy. These treatments cannot help with any of the neurological symptoms. Enzyme replacement therapy is an infusion that will briefly stop the symptoms of Gaucher's by allowing the patient to gain some of the enzymes that are not naturally produced in their body. Substrate reduction therapy is similar to enzyme replacement. However, instead of breaking down glucocerebroside, it stops the body from producing the molecule in the first place. These are only treatments, however. There is no cure or prevention method for the disease as of now. The current direction scientists are taking with research for Gaucher's disease is trying to find a cure and trying to make infusions more effective. Recently, they've also found new untested forms of treatment like the AAV and lentiviral enzyme therapy types. Cure research at the moment has brought us these new treatment types and a better understanding of the disorder as a whole. However, no cure has been discovered as of yet.